I'm Michael Battelle, president and founder of the Fatty Liver Alliance. We raise awareness about the risks, causes, and complications of fatty liver disease and help those already diagnosed with MASLD and MASH by advocating for access to approved treatments and care. Today, as part of our patient-focused series, Liver Insights, Illuminating the Path Through MASLD and MASH, I am very excited to introduce Professor Jeffrey Lazarus, who's the head of the Health Systems Research Group at ISGlobal and associate professor at the University of Barcelona, as well as a full professor at the CUNY Graduate School of Public Health and Health Policy in New York City. Today, in part 10 of our special series for patients who have already been diagnosed with MASLD and MASH, we will be discussing community and support systems, building and leveraging support networks for enhanced coping and management of MASLD and MASH. Jeff, you have a unique combination of practical experience in health systems management, research on disease and policy, leadership in global health initiatives, and your work exemplifies the importance of interdisciplinary approaches and global collaboration in tackling public health challenges. Where should patients start if they want to build their own networks that will help them cope with MASLD and MASH?
Thanks, Michael. I'm really pleased to be speaking with you today, and thank you for all the great work of the Fatty Liver Alliance. It's incredibly important that we have you and other patient advocacy groups working to, bring patients together, but also raise the patient voice in all of this. So let me start with some good news and some bad news. If you're a patient listening and you've been diagnosed with MASLD or the more aggressive MASH, the good news is that you've been diagnosed, because most people have actually not been diagnosed. And when I say most people, I don't mean 40 or 50 or 60 or 70%, but probably well over 80 or even 90% of people are undiagnosed. So you're undiagnosed. So you are now diagnosed. That's good news, not that you have MASLD or MASH, but that you know that you have it, because there's even better news, which is that there's a lot that can be done. Even if we don't have a MASH specific drug, there are lifestyle interventions, including nutrition, caloric reduction, so eating less, eating better quality food, and also physical exercise. They help a lot more than you might think. There are also therapies, not for MASH specifically, but for obesity, for diabetes type 2, if you have that comorbidity. So there are things that can be done from your general practitioner, from your hepatologist, or from your endocrinologist if you're also seeing one of them. The bad news is that there's not a lot of support. There's not a lot of support in terms of the number and let's say reach of patient groups, but likewise, there's not a lot of support within the health system. A lot of people just don't understand what MASLD is. They don't understand why it's serious. When you have MASLD, you have excess fat in the liver. That's serious because it can progress to serious liver diseases, end-stage liver disease, cirrhosis, even liver cancer, but it also impacts on diabetes and cardiovascular disease. In short, the new definition, we've moved from non-alcoholic fatty liver disease to metabolic dysfunction associated steatotic liver disease. And steatotic really just means fatty, but to avoid stigma, we use steatotic. But the metabolic dysfunction is where I want to focus. When you have MASLD, you have the hepatic manifestation. So the manifestation in the liver of a failure, of a dysfunction in your metabolic system. So we understand that working in the health system, but a lot of people don't understand the importance of that, even at the general practitioner level, but also among endocrinologists, since there's not a MASH specific drug. So in terms, Michael, of building support for patients, you can be, if you have a co-infection, there are often stronger, more developed patient groups in the field of diabetes, also in the obesity space, where you can be engaging with those patient groups. There are groups now, increasingly so, that are addressing the liver specifically, so one can engage with them as well. And then there are also, if you're in a particular risk group, they're often online or even now face-to-face groups where you can meet with people and talk about these issues, maybe the stigma you face or the challenges you face in sustained weight loss. And thankfully, there are a lot of great hepatologists who really want to help you. The issue, as I mentioned, is that most people are not diagnosed and not reaching even their general practitioner or an endocrinologist.
And so, Jeff, if patients know that they have either mast cell or MASH, but like most patients, they have no symptoms because it's the silent disease, and that's even it's kind of weird because you're sick, but you don't know you're sick. So, should they still seek out these networks to learn about the diseases and what they can do to improve their health?
It really should. And there's lots of diseases that are asymptomatic for a long time. I mean, not just non-communicable diseases, but infectious diseases like HIV and viral hepatitis can be years. In the case of viral hepatitis C, decades where it's silent. Diabetes is silent until it's not silent. Cardiovascular disease is silent until it's not silent. You can have a heart condition that hasn't gone detected for years and years, and suddenly you have a heart attack and you didn't know earlier that you had high blood pressure and so on. So it's not that unusual. It's just not as acute at all in any way as so many other diseases. So if you do know you have it, I think you're lucky. You're lucky that you know. You're not lucky that you have it, but you know, and you should seek out information because mast cell D or fibrosis is reversible. It's reversible in the early stages, and there's a very simple scale from F0 to F4. F for fibrosis. So if you know your fibrosis stage, and if you've been diagnosed, you should ask and make sure you know that. If you have a fibrosis stage 1 or 2, it can be, I would say, fairly easily reversed by no alcohol intake and again by those lifestyle interventions. They're not always easy. It's not always easy to eat healthy. It can be more expensive. It can be more complicated, to get that food. It's not always easy to exercise. It requires time, safe places to go and exercise if you're exercising outside. But again, that's very different than a course of chemotherapy, a lifelong treatment with pills, having multiple operations. So when I say it's easy, it means that it's something that you can do if you have the support system. And we know that to sustain changes in our lives, not just eating and exercise, it's easier when we have support from our family, from our friends, or if not them, or in addition to them, patient support groups. So I strongly encourage everyone with MASLD to seek out that kind of support. There's nothing to be ashamed of. There's nothing to hide. You have excess fat in your liver, and there's things you can do to change that. You should.
I would love that you talked about the family aspect of it because you published recently in an article that globally 38% prevalence rate for mast, which is like much higher than the 25 that was talked about before. So that leads us to also think about our own families and that a lot of these comorbidities run in families too. So the fact that you suggested that they should have the family as a network is really important, not just for them as the patient, but also because they may have other patients in their family as well.
Absolutely. So I really believe in the importance of a family doctor. I'll usually call it general practitioner, but that's where that doctor needs to say, your child's been diagnosed. Therefore, the parent should be, or more likely, vice versa, other family members, including children, should be if a parent was. So that prevalence article published by Dr. Zavarianassi and his team found that globally, more than 1 in 3 adults have MASLD. And there's great variation among countries, but also within countries. So in some populations, if you have diabetes type 2, if you are overweight slash obese, those numbers can hit 50, 60, even 70%. So we know where to look to find people. The question is changing the system so we test. But it does mean that no matter how you cut the deck or slice the cake, there's a lot of people with MASLD. And so there's, again, nothing that should stop you from being open about this or talking to your GP or a specialist about getting a test so you're aware, because again, this can be reversed. And when you address MASLD, you're addressing your general health. Exercise is good. Um, Good quality food, highly nutritious, is good. It's good for you for so many reasons. That's why we're talking about metabolic dysfunction associated liver disease and not just a liver disease. This is good for your heart. this is good for your kidneys, it's good for your liver, it's good for your whole system.
Amazing conversation. Thank you for sharing your insights. And you have a lot to share in a short period of time. So thank you very much for today and for what you're doing for patients every day, the work that you do.
Thanks, Michael, and best of luck to everyone.